Hello, I'm Dr. Kalimag, and today I will be discussing primary healthcare and sustainable development goals. These are the objectives of the session. At the end of the session, the participants shall be able to discuss the special characteristics and elements of primary healthcare, discuss the Alma-Ata Declaration, the Sustainable Development Goals, and the Astana Declaration. Differentiate primary healthcare and primary care. Okay. Your reference for this lecture is your ComMed manual. Please read pages 9 to 49 and answer workshop 1 after this lecture. But I will be helping you by highlighting the key points of the text in this lecture. So please read the introduction of the Alma-Ata Declaration in your manuals on page 10. So this was during the first International Conference on Primary Healthcare. It was conducted in Alma-Ata, which is in Kazakhstan. It was jointly convened by WHO and UNICEF and is a major milestone of the 20th century in the field of public health. Okay, so the Declaration of Alma-Ata identified primary health care as the key to the attainment of the goal of health for all. Okay, but first, we must know the setting. Why was there a need for the Alma-Ata Declaration at the time? So this is the milieu. Even in the 70s, there was a widening gap in health status between developed countries versus developing countries. Health resources are allocated to sophisticated medical institutions in urban areas. The improvement of healthcare is being equated with the provision of medical care by growing numbers of specialists. So there was a move towards specialization at the time, and that there was parang yan na lang yung nagiging basis for good healthcare. Okay. But the use of medical technologies was for the benefit of the privileged few. Hence, there was the response was the Alma-Ata Declaration. These are the key points of the Alma-Ata Declaration. It states that health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, is a fundamental human right. Okay, so health is not a right only of those who can afford it, not only for those who live in urban areas with easy access to it, and not only for those with power or social status, but according to the Alma-Ata Declaration, it is a fundamental human right, so everybody should have health or access to health. And the existing gross inequality in the health status of the people, particularly between the developed and developing countries, as well as within them, is politically, socially, and economically unacceptable, and is therefore of common concern to all countries. So one of the key points of the Alma-Ata Declaration is community participation. Please remember this. The people have the right and duty to participate individually and collectively in the planning and implementation of their healthcare. So you want active participation by the members of the community, by the people themselves, in deciding what is important to them in their healthcare and what programs, what activities are important to them. Okay, and governments have a responsibility for the health of their people. A main social target of governments, international organizations, and the whole world community in the coming decades should be the attainment by all peoples of the world by the year 2000. Okay, so remember, the Alma-Ata Declaration was in the year 1978. So their target at the time was the year 2000, of a level of health that will permit them to lead a socially and economically productive life. And primary health care, as the approach, is the key to attaining this target as part of development in the spirit of social justice. Okay, so let's define primary health care. Primary health care is essential health care based on practical, scientifically sound, and socially acceptable methods and technology. Made universally accessible to individuals and families in the community through their full participation, and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. So primary healthcare is kind of an ideal and an approach, to providing essential healthcare. Primary healthcare addresses the main health problems in the community, providing the full spectrum of care from promotive, preventive, curative, and rehabilitative services accordingly. Now in the UHC law, meron ng panglima, the palliative part of the spectrum, okay? So palliative care. Primary healthcare includes at least the following elements. So these are the essential elements of primary healthcare. The acronym elements is not really included in the Alma-Ata Declaration, but it's just a way for you to remember these components that PHC should at least have. But please note that the concept of PHC is not limited to these components. Okay, so please remember the acronym elements. E is for education concerning prevailing health problems and the methods of preventing and controlling them. L is for prevention and control of locally endemic diseases. E for provision of essential drugs. M for maternal and child health care, including family planning. E for expanded immunization against the major infectious diseases. Promotion of food supply and proper nutrition for N. P for appropriate treatment of common diseases and injuries. And S for an adequate supply of safe water and basic sanitation. So these are the basic programs or parts of services that should be included in primary healthcare. So what a doctor does, which is the usual medical consultations, is only, if you can see, it's only a small part of primary healthcare. Primary healthcare also includes the public health programs and programs that address the social determinants of health, such as poverty reduction programs and education programs, and etc. In 1994, WHO wrote this document, Health for All, Global Well-Being. The goal was still health for all by the year 2000. They again endorsed the declaration of the Alma-Ata. So what we're doing is we're kind of going through history since 1978 going to the present. Okay, so at this time in 1994, they again endorsed the values of the declaration of the Alma-Ata, and they identified 4 pillars for primary healthcare. So this will elucidate primary healthcare for us. So the first pillar is political and societal commitment and determination to move towards health for all as the main social target for the coming decades. So you need the support of political leaders and civic organizations. Primary healthcare cannot be done just by purely health workers. Kailangan yung mga political leaders talaga. And again, community participation is emphasized. The active involvement of people and the mobilization of societal forces for health development. Members of the community should not just be passive recipients of health services and programs. For intersectoral cooperation, this would be between the health sector and other key development sectors such as agriculture, education, communications, industry, energy, transportation, public works, and housing. Intersectoral cooperation is needed to address the social determinants of health. For system support, we need that to ensure that essential healthcare and scientifically sound, affordable health technology are available to all people. Then, what was the effect of putting the declaration of Alma-Ata to work? There have been improvements since the declaration of the Alma-Ata and the practice towards primary healthcare. In developing countries, there was noted improvement in infant mortality rates, deaths among children under 5, and life expectancy. Life expectancy in 1994 had risen to 65 years for the world as a whole. Immunization coverage against childhood diseases increased dramatically between 1970 and 1992, from less than 5% to around 80%. Access to oral rehydration therapy had increased to approximately 74% by 1993. And for developed countries, their emphasis was more on non-communicable diseases and addressing the lifestyles and behavior that minimize the risks of these illnesses, along with acquired immunodeficiency syndrome, AIDS, and injuries, and on creating and maintaining environments supportive to health. There was a noted reduction in tobacco smoking and improvement of dietary habits, reflected in a dramatic decline in deaths from cardiovascular disease. And the problem in developed countries was the heavy cost of medical care. So to address that, there were health policies that emphasized caring and prevention in addition to curing disease. So please note that prevention is usually less costly than the curative treatments, okay? So for example, having chemotherapy and hospitalization for lung cancer would be very expensive, but how cheap would it be, or how much less costly would it be to promote reduction in smoking, okay? So that's an example. However, much still needs to be done. Health conditions in developing countries must be viewed in a wider socioeconomic context, where nearly 1,000 million people are trapped in the vicious circle of poverty, malnutrition, disease, and despair. And some 100 million children are currently denied primary school education. 1,500 million people have no access to basic health services, and 1,750 million people have no access to safe drinking water. The philosophy and strategies underlying the Declaration of Alma-Ata have continued to evolve, serving as an important foundation for further progress. So despite all the decades that have passed since 1978, until now, we still espouse the philosophy and strategies of the Alma-Ata Declaration. Along the way, in the 1980s, there were other conferences that sought to identify strategies that could lead to progress towards health for all. One of these is the Ottawa Conference in 1986. This is the Charter for Health Promotion. Health promotion is a very important concept in public health. So when you talk about health promotion, you always go back to this foundation set during the Ottawa Conference. It proposed a strategy comprising 5 action areas for health promotion, namely building healthy public policy, creating supportive environments, strengthening community action, developing personal skills, and reorienting health services. So for example, instead of telling people to stop smoking, you could create a public policy that would yung parang sin tax, for example. So you would have increased taxes for cigarettes. Or if you want people to exercise more, then you would need to create supportive environments for them to exercise. So for example, having sports facilities or having parks where people can actually exercise. So health promotion should not just be limited to education or telling people what they should do for their health, but also in creating the enabling or supportive environment for them. Okay, so for Health for All in the 21st century, this was in 1998, also from WHO. WHO wanted to develop a shared vision by listing the 10 most important health issues. They formulated 10 targets to motivate all member states to take action and to set priorities for resource allocation. These are the 10 targets. Okay, no need to memorize these. So they had 4 health outcomes: childhood stunting, MMR, CMR, life expectancy, the 5 major pandemics, and eradicating and eliminating certain diseases. So I just want you to be familiar with the targets that the WHO has been setting through the past years. The 2 determinants of health that were targeted were improvement of access to water, sanitation, food, and shelter, and measures to promote healthy lifestyles. And the 4 targets on health policies and sustainable health systems were the National Health for All policies, improving access to comprehensive essential health care, implementing global and national health information and surveillance systems, and support research for health. So the WHO is always setting and resetting targets. Targets may change, but the ideals remain the same. This is still based on the Alma-Ata Declaration. And now for our most recent worldwide targets, these are the 2030 Agenda for Sustainable Development. The Sustainable Development Goals. This was set during the United Nations Sustainable Development Summit in 2015. Excuse me. There are 17 SDGs, and these are to end poverty, fight inequality and injustice, and tackle climate change by 2030. There are 17 SDGs, but all in all, there are 169 targets under the 17 SDGs. These build on the Millennium Development Goals. So prior to the Sustainable Development Goals, there were the Millennium Development Goals, pero na-phase out na siya ngayon, and we follow the SDGs now. The SDGs integrated and balanced the 3 dimensions of sustainable development: the economic, social, and environmental. So notice that health is not even one of the 3 dimensions, pero it's included in the overall. So these are the 17 SDGs. And number 3 is for good health and well-being. So we will just run through the 17 SDGs. No need to memorize each SDG, but just focus on the one for health. Okay, goal 1 is to end poverty in all its forms everywhere. Goal 2 is to end hunger, achieve food security, and improve nutrition, and promote sustainable agriculture. Goal 3 is to ensure healthy lives and promote well-being for all at all ages. Goal 4 is to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. Goal 5 is to achieve gender equality and empower all women and girls. Goal 6 is to ensure availability and sustainable management of water and sanitation for all. Goal 7, to ensure access to affordable, reliable, sustainable, and modern energy for all. Goal 8, promote sustained, inclusive, and sustainable economic growth, full and productive employment, and decent work for all. Goal 9, build resilient infrastructure, promote inclusive and sustainable industrialization, and foster innovation. Goal 10, to reduce inequality within and among countries. Goal 11, make cities and human settlements inclusive, safe, resilient, and sustainable. Goal 12, ensure sustainable consumption and production patterns. Goal 13, take urgent action to combat climate change and its impacts. Goal 14, conserve and sustainably use the oceans, seas, and marine resources for sustainable development. Goal 15, protect, restore, and promote sustainable use of terrestrial ecosystems, sustainably manage forests, combat desertification, and halt and reverse land degradation and halt biodiversity loss. Goal 16, promote peaceful and inclusive societies for sustainable development, provide access to justice for all, and build effective, accountable, and inclusive institutions at all levels. And lastly, Goal 17 is to strengthen the means of implementation and revitalize the global partnership for sustainable development. So again, only SDG 3 is focused on health, but if you recall the social determinants of health like socioeconomic status, education, security, etc., you would notice that the other SDGs tackle those social determinants of health. And if we work on the other SDGs, those would also have an impact on health outcomes. Therefore, we should support and advocate for the other SDGs as well. Okay, these are the specific targets under SDG 3 for health and well-being. Please familiarize yourselves with these targets. Maternal mortality to less than 70 per 100,000 live births. Neonatal mortality as low as 12 per 1,000 live births. Under 5 mortality to as low as 25 per 1,000 live births, end the epidemics of AIDS, TB, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases, reduce by 1/3 premature mortality from non-communicable diseases, ensure universal access to sexual and reproductive healthcare services, and by 2023, substantially reduce the number of deaths and illnesses from hazardous chemicals in air, water, and soil pollution and contamination. By 2020, have the number of global deaths and injuries from road traffic accidents, strengthen the prevention and treatment of substance abuse, achieve universal health coverage. Okay, so there are even more targets under these, no? More specific targets, pero hindi na natin i-discuss yan. This is the Philippines' progress on the SDGs based on the 2023 SDG Watch by the Philippine Statistics Authority. You can see here the goals 1 to 17. And for goal 3, we have since year 2000. Since year 2000, we have had just a small progress, no? The target for 2030 is up to here, and ito pa lang yung na-accomplish ng Philippines. Okay, so for other goals, even there was there was even a regression in color red, and then yung mga naka-crisscross is for insufficient indicators. And for the pace of progress, this is for all the goals. Only a few of the targets were on track. Many of the targets were in need of acceleration in order to reach the target by 2030. And most of the targets had regressed. Probably the COVID pandemic had a big impact also as to the regression. And for data availability, there are still a lot of indicators with insufficient or no data. However, for goal 3, majority of targets have data. Okay, then we fast forward to a few years ago in 2018, there was the Declaration of Astana, 2018. This was held again in Kazakhstan. So parang it's kind of commemorating the Alma-Ata Declaration, but it was now in Astana, not in Alma-Ata. This declaration affirmed our commitment to primary health care in pursuit of health and well-being for all, leaving no one behind. In 2015, leaders signed on to the Sustainable Development Goals, which renewed commitment to health and well-being for all based on universal health coverage. So you recall the SDG 3, one of the targets was to achieve universal health coverage. So the Declaration of Astana is addressing this now, the UHC. UHC means that all people, including those who are marginalized or vulnerable, should have access to quality health services that put their needs at the center without financial hardship. So universal health coverage is actually, as a concept, it focuses on access, everybody being covered or having access to health, including those who are marginalized or vulnerable. The Declaration of Astana states that PHC is still the most effective, efficient, and equitable approach to enhance health, making it a necessary foundation to achieve UHC. Okay, so UHC will not and should not replace primary health care. UHC is a narrower concept than primary health care, focusing on access to health services and making it affordable. But UHC will not address the social determinants of health. It will not address the poverty, lack of employment, lack of education, the overcrowded settlements that are some of the root causes of poor health. So we should not abandon the ideal of PHC, but retain it as the foundation of universal healthcare. Okay? So minsan kasi, UHC na lang yung nagiging goal, tapos nakakalimutan na yung primary healthcare as a foundation. The Declaration of Astana states that at least 80% of health needs can be addressed through this vision of PHC and UHC. We need to take deliberate actions to reinforce the three components of PHC, emphasizing greater equity, quality, and efficiency. So remember the difference between equity and equality. If for equality, you give the same amount of resources to all the members or all the citizens, for equity, that's not what you do. You give more to those who need more. Okay? So para makaahon sila. And then quality of care, and then efficiency, meaning minimizing wastage of resources. So the Declaration of Astana states that they're saying we are optimistic because our success will be driven by these things. Meron ng progress since the Alma-Ata Declaration. So political will, we have now more partners and more stakeholders, both public and private, working toward common goals in the SDGs. Our success will be driven by also increased knowledge. Decades of health systems research have generated solid knowledge of how to address the determinants of health, reduce inequalities, prevent and treat disease, and promote health for all people. We also have now more technology, more effective, more affordable medicines, diagnostics. We now have more digital technologies which can be harnessed to improve health literacy, enabling people and communities to take control of their own health. And we have also advances in information systems, so that we can gather more data on our health status and on our health systems. And our success will be driven by the people. We are more informed, more connected, and have higher expectations. People also have more say in the governance, planning, and delivery of healthcare through general elections and health assemblies. So they're saying there is, and that population health literacy is rising, prompting more individuals to mobilize and assert their right to health and to healthcare, creating social accountability of both the public and private sectors. So I hope that your generation would be part of this, the more informed, more connected, more health literate generation. It's important for all doctors to be informed about our health systems, be informed. I hope that you would be informed about the UHC, be involved in the process, be an advocate, create social accountability. And even if you don't go into public health, whatever field of medicine you go into, I hope that you will always have the bigger picture in the back of your mind. That is the ideals of primary healthcare. To address today's challenges and seize opportunities for a healthy future, we must empower people to take ownership of their health and healthcare, make bold political choices for health, avoiding political and financial conflicts of interest. So dito naman usually tayo nagkakaroon ng problem when it comes to public health, the political interests and financial interests of a few. So we need to improve participatory governance of health systems, including engaging and regulating also the private sector. We need to put public health and primary care at the center of UHC. Align partner support to national policy, strategies, and plans. Okay, let's tackle more the public health and primary care at the center of UHC. So to do that, we need to have primary care that is continuous, comprehensive, coordinated, community-oriented, and people-centered. Okay, that's a lot of words. So continuous just means yung continuity of care ng patient. Ideally, kung ikaw yung doctor niya, ikaw palagi yung doctor niya. Hindi palipat-lipat, because There is a waste of resources. Every time the patient goes to a new doctor, then they have to repeat the history, then may mga makakalimutan, then may mga mamimiss. As compared to if you have just one doctor focused on you, and then for the part of being coordinated, you coordinate to other specialists as needed. And then for comprehensive care, you give the whole spectrum of care from promotive, preventive, curative, rehabilitative, and palliative. And don't forget the community-oriented and people-centered part. So you need to address what the people deem important. What is the felt need of the people? So yung people yung masusunod, no? So ano din siya, values-based. And then prioritize disease prevention and health promotion. Ensure adequate public health and primary care workers. So our problem now is until now, we still have so many doctors, nurses, and allied health workers who are leaving our country. So there should be a solution an incentive for them to stay. So we need adequate compensation, meaningful opportunities for professional development and career progression, availability of appropriate medicines, products, and technologies, and resources for research evaluation, and knowledge management, promoting the scale-up of effective strategies for multisectoral action, public health, and primary care. So what's the difference between primary healthcare versus primary care? Please don't be confused. So I will give you the definition of primary care. Primary care, according to the Institute of Medicine, is the provision of integrated, accessible healthcare services by clinicians who are accountable for addressing a large majority of personal healthcare needs, developing a sustained partnership with patients, and practicing in the context of family and community. So primary care usually focuses on first contact care. Ikaw yung unang titingnan as opposed to specialized. Ikaw yung unang titingin, sorry. You will be the first doctor to see the patient as opposed to specialist care na. You will be waiting for the referral. So that's primary care, and then primary healthcare is what I've just discussed. So if you forgot what is primary healthcare, please review the concepts again and try to differentiate. Nasa workshop niyo din yun to differentiate these two. Primary care is a part of primary healthcare, but they are not the same, okay? So how do public health practitioners put into practice the abstract concepts of primary healthcare? So WHO made this PHC monitoring framework. So let's see the PHC components here. Ito yung mga diniscuss natin na concepts. Integrated health services, multisectoral policy and action, empowered people and communities. And then here you have the health systems building blocks. We will be discussing that in the next lectures. Okay, so you have governance, financing, physical infrastructure, health workforce, medicines and products, health information. So for each of these, meron yan targets. No? And then you have here the processes for service delivery, like the organization of the facilities, community linkages, what services will you give. And then the outputs are access and availability and quality care. And then the outcomes are universal health coverage, the service coverage and financial protection, meaning nobody will be impoverished, no, because of having to be hospitalized or for needing health services. And then the final impact is the improved health status, the actual health outcomes, the morbidity and mortality. And the impact is also the responsiveness, which is being responsive to the felt need of the people, of the community, and equity. Okay. So every step of the way, meron yan mga measurable targets so that we can monitor our progress towards attaining primary healthcare. Since primary healthcare is really very difficult to achieve, pero as long as we are going on the right track, then I think that is good enough, at least for now. Okay, so this is my last slide. If you have any questions, you can message me on Canvas and I will be answering your questions during our live Q&A. Okay, thank you for your attention. Goodbye.